Swastiastu. Good morning, doctors and friends. Today, Group B7 will discuss about oral PDE5 inhibitor for erectile dysfunction. Please enjoy.
Hello, my name is Sarah Prabudina Sakti with student number of 253 and I will explain about the background of this paper. So, erectile dysfunction is an inability to achieve to maintain an erection for psychosexual needs. Available intervention to minimize ED is lifestyle modification and injected vasodilator agents, vacuum erection device, and the first line treatment of pharmacotherapy is oral PDE5 inhibitor. Although PDE5s are indicated as the first line treatment, it can inhibit other PDE isomers, affecting other target tissue, causing unnecessary side effects. This paper is made to review how appropriate to use oral PDE5 inhibitors to treat erectile dysfunction and how it works.
Hello, my name is Zaki Arafi ID with student number 122. So today I will tell you about the pharmacokinetic of PDE5 inhibitor. So, PDE5 inhibitor undergoes metabolism predominantly through the hepatic isoenzyme cytochrome P450 CYP2A4 pathway. Minor pathway includes CYP2C9 for sildenafil, also known as Viagra, and CYP3A5 accompanied by CYP2C for vardenafil, also known as Levitor. The mean absolute bioavailability is approximately 41% for sildenafil or Viagra and 50% for vardenafil. PDE5 inhibitors are eliminated predominantly as metabolites in the feces and to a lesser extent in the urine. Thank you, and the other part will be continued by my friend.
Hello, my name is Daniel Sulung Utama Sirimuringo, student number 045. I'm going to explain to you what would happen to our body if we take oral PDE5 inhibitors. PDE5 inhibitors inhibits the PDE5 isoenzyme. Inhibition of PDE5 isoenzyme can result to intracellular accumulation of cyclic GMP. The accumulation of cyclic GMP then activates the cyclic GMP-dependent protein kinase. Cyclic GMP plays a central role in signal transduction and regulates a number of physiological responses, such as muscle relaxation, platelet aggregation, and cardiac function. Therefore, if we take the oral PDE5 inhibitors, it can cause muscle relaxation, platelet aggregation, and cardiac function of our body. Thank you.
Hello, my name is Shantika Apriya Rahmawati with my student number 106. Here I want to explain the mechanism of action of PDE5 inhibitor. Mechanism of action of PDE5 inhibitor is by inhibiting PDE5 activity so that it can prevent degradation of CGMP and lead to CGMP accumulation in the vascular smooth muscle, resulting in dilatation of the blood vessels. Therefore, more prolonged erection can be achieved. PDE5 inhibitor increases endothelial function and reduces vascular smooth muscle cells apoptosis in corpus cavernosum. Since the stimulation pathway of sexual arousal, particularly within the penis, PDE5 inhibitor have relatively small effect on smooth muscle in other tissues. Besides that, PDE5 inhibitor is easy to consume and has high effectiveness, so that represent a major first-line oral therapy option for men with erectile dysfunction. Thank you.
Hello, my name is Budapina Masana Radika with student number 239. Now I'll explain about the indication and contraindication PDE5 for erectile dysfunction. PDE5 inhibitors have become the first-line therapy for erectile dysfunction. Sildenafil, vardenafil, tadalafil, and alfanafil have been approved for use as required in the treatment of erectile dysfunction. PDE5 isoenzymes have been identified in some various tissue, meaning that PDE5 inhibitors will have an effect on many organs and functions, including in unapproved indications such as diabetes, cancers, and the others. Generally, clinical guidelines suggest that PDE5 is contraindicated in some conditions, such as congestive heart failure, uncontrolled hypotension and hypertension, hypertrophic obstructive cardiomyopathy with severe symptoms, refractory or unstable angina pectoris, recent myocardial infarction, high-risk arrhythmias, and many more. In patients taking nitrous or nitroglycerin is considered an absolute contraindication because concurrent use of PDE5 can lead to excessive reduction of breathers. That's all. Thank you.
Hello, my name is Pratista and my student number is 227. So now I'm going to explain about the dose and dosage of PDE5 inhibitor for erectile dysfunction. PDE5 inhibitors have different dosage for each drug. The usual recommended dose of sildenafil for erectile dysfunction is 25 mg to 100 mg per oral, 1 hour before intercourse. The dosage of sildenafil in men with severe renal impairment and mild to moderate hepatic impairment, it is recommended to start with a dose of 25 mg as a precautionary measure. The recommended dose of tadalafil is 5 mg to 20 mg per oral 1 hour before intercourse. In patients with moderate renal insufficiency, it is recommended that the initial dose of tadalafil is 5 mg no more than once daily, with a maximum of not more than 10 mg in 48 hours. The recommended dose of vardenafil is 10 mg to 20 mg per oral 1 hour before intercourse. In patients with moderate hepatic impairment, the recommended starting dose of vardenafil is 5 mg with a maximum dose of 10 mg per dose.
Hello, my name is Dara Cynthia Augustine with my student number 069, and I will explain about the clinical efficacy of PDE5 inhibitors for erectile dysfunction. Erectile dysfunction, or ED, is common sexual dysfunction which primarily affecting men over the age of 40 years. ED is clinically defined as hardness of penile erection that is insufficient to insert into the vagina, or the penile cannot maintain a full erection during sexual intercourse. A 3-month duration of this symptom is usually accepted as criteria for diagnosis in patients without trauma or surgery. The etiology of ED is classified into 3 causes. Those are psychogenic, organic, or mixed between psychogenic and organic. Phosphodiesterase 5 or PDE5 inhibitors are the first line of oral drugs which is recommended by WHO for the treatment of ED. PDE5 inhibitors are selective, competitive, and reversible, generally working to decrease cGMP metabolism and ultimately leading to successful attainment and maintenance of an erection. PDE5 inhibitors are used as symptomatic management that should be accompanied by a simultaneous removal of etiology of causing the ED. The 4 major drugs of PDE5 inhibitors are sildenafil or Viagra, tadalafil or Cialis, vardenafil or Levitra, and alfanafil or Stendra. That's all from me. Thank you.
Hello, my name is Nanda Parmesti with student number 167. Continue from their explanation, one of the clinical effects of PDE5 inhibitors can be seen in its role in erectile dysfunction, where smooth muscle relaxation occurs in the corpora cavernosa due to the release of nitric oxide from endothelial cells and nitric neurons around the arteries, and the sinusoids respond to the release of acetylcholine from the end of the parasympathetic synapse. Sildenafil, a type of PDE5 inhibitor, is being the first-line therapy for erectile dysfunction in men who have no specific contraindication to the use of this oral drug. First, the chemical structure of sildenafil has similarities with cGMP. The similarity protects the breakdown of cGMP because sildenafil can bind to the competitive inhibitor of cGMP. When PDE5 is inhibited, there is accumulation of cGMP, which will increase the activity of protein kinase in smooth muscle target organ, preceded by a decrease in calcium ion, an increase in excretion of potassium ion, and the inactivation of myocyte-like chain kinase, resulting in smooth muscle relaxation. In patients with erectile dysfunction, 1 hour before sexual activity, sildenafil can be taken orally at a dose of 50 mg. This dose can be increased or decreased depending on the effectiveness and tolerance of the drug in the body. Sildenafil should be prescribed with caution in a patient with frequent changes in blood pressure. Thank you.
Hello, my name is Putri Indria and my last year number is 200, and now I'm going to talk about the side effects of PDE5 inhibitors to treat erectile dysfunction. So the first side effects and the most common side effects including nausea, the feeling of nausea, and headaches. But in some cases, in some person, this can also cause prolonged erectile. And in other patients, even though the percentage is really low, it can also cause loss of hearing and loss of visual. And if these side effects occurs, the patients are recommended to go to the doctor. That's all I can say. Thank you.
Good morning, doctor and friends. My name is Putu Andrea Sebastian with student number 143. So I'm going to explain about drug interactions of PDE5 inhibitors. The first drug is the CP3A4 isoenzymes. When the potency of the CP3A4 isoenzymes is increased, when interact with the PDE5 inhibitors, it will leading to increase of plasma drug PDE5 concentration, that will leading to decreasing of the clearance rate. The second is the alpha blockers. When the alpha blockers and the PDE5 is interacting, it will leading to increase of vasodilatation effect, that will leading to decrease of blood pressure rapidly. The third is the nitrates. When the nitrates and the PDE5 inhibitors is interacting, it will cause the cGMP activity to increase and leading to increasing of the relaxed foot muscle. This will cause the decrease of the blood pressure rapidly. Thank you.
Hello everyone, my name is Roger Pasasi with last 3 student number 021. So the next one is the drug interaction between PDE5 inhibitor with antiarrhythmics. Interval QT elastography is a substitute for prolonged ventricular repulsation and can lead to changes in cardiac contractility, torsade de Pons, and ventricular tachycardia. And the next one is the drug interaction between antacids and PDE5 inhibitor. And based on studies that have been conducted, single-dose antacids or H2 inhibitor agents such as aluminum hydroxide and magnesium hydroxide could reduce 30% of tadalafil absorptions. And the last one is the drug interaction between testosterone and PDE5 inhibitor. Based on studies that have been conducted, interaction between PDE5 inhibitor and testosterone could upregulate NOS activity, acting through an increased expression of neuronal or endothelial isoforms. Testosterone could also regulate cGMP degradation, PDE5 expression, and improvement of PDE5 inhibitor outcomes in hypogonadal patients. Thank you.
Hello, my name is Mani and the last 3 digits of my name is 249. Today I'll be talking about the conclusions, which is 3.1. There are 3 common drugs that contain PDE5 inhibitors. These drugs are sildenafil, vardenafil, and tadalafil, and each of them have a unique pharmacokinetic. PDE5 inhibitors have become the first-line therapy for erectile dysfunction. PDE5 inhibitors have different dosage for each drug. Patients usually complain of having headache, flushing, nasal congestion, nasopharyngitis, and dyspepsia as the most common adverse drug reaction. PDE5 inhibitors can also interact with other class of drugs such as CYP3A4, isoenzymes, alpha blockers, nitrates, antiarrhythmics, antacids, and testosterone. Thank you, and that's all from me today.
That's all from our presentation. Thank you for your attention, and we close it with Paramasan. Om Santi Santi.